So healthcare has been undergoing this transition from fee-for-service to value-based care. So when you think about being successful in this new world and payment model, it's essential that you work with your community-based providers and really looking at all the opportunities and things that they bring to the equation. Those are their clients. Their mission is to serve that client, whether it's for a home-delivered meal or transportation. Over the last 3 years, Flagler Health Plus launched Flagler Health Care Connect, this alliance of community resource providers that are on the same share of vision to address social determinants of health in a more coordinated way. And so we really look to grow within that network, and by doing so, really being sustainable as an organization means that we need to have ways to provide value to our community. And so the three big areas we're looking at now are homelessness, youth behavioral health, and then aging friendly communities. So I think it's important when we think about community providers that it's a win-win relationship for both sides. And so a part of what we're doing is really looking at the end of the day, we want to increase their capacity and their ability to fulfill their missions. For us, it's usually between access and coordination. So our community, just like every other community, has issues with access to care. And so whether it's behavioral health providers or rapid rehousing programs, there's never enough resources to really meet the needs. And so getting creative and really aligning under the same vision with our providers, we're able to create new streams of funding so that we can address those needs in alternative ways. Specifically, the Council on Aging with medication assistance, we can help support their operations through community impact grants. Also, a big component is the community services system itself. We provide that to all partners free of charge. And there's actually been 2 cases where the agency developed and grew their program in community services to take on take other systems off their plate. So Flagler Hospital utilizes community services software as our homeless management information system. And so what that means for us is that we have an electronic way to identify needs, to intake clients no matter what access point they're coming from, and also we're able to make electronic referrals to our agencies. And so community services has really become the backbone to the work that we do at Flagler Hospital, because without it, there's no way to tie all these agencies together. And so that's been integral. WellSky is a huge piece of our vision to being able to provide value to our community. And so what's been exciting to us is to see that a lot of the gaps we see in our community have been filled with utilizing community services.